Hi, my name is Becca Hart. I'm one of the Pediatric Emergency Medicine attendings, and I also am the Director of Scholarly Activity for our residents. So I get the wonderful experience of working with our residents to find a scholarly project and a mentor for their requirements for residency and to guide them through that process as they go through their training.
I'm interested in expectations for research. What kind of projects do residents typically do, and what kind of support do they get?
That's a great question, Ben. So our residents do a lot of different kinds of projects, and these can really be as varied and interesting as the interests of our residents. Some people do sort of classical, original research where they're either actively recruiting patients for an intervention or doing some clinical chart review, which is a little bit more common. But our residents can also do things like quality improvement projects, or some of them pursue advocacy projects where they're working on community health and doing catch grants and things like that to improve the health of patients in our area. Residents perform global health projects, which might take place either here or abroad. Other options are things like case reports or case series, although we require those to be submitted somewhere if you're going to publish a case report. Residents can also engage in writing book chapters or systematic reviews, although that's a little bit less common. But really, the sky's the limit as far as what you are interested in. I always tell people that it's way more important to have a project that you love and are really passionate about than it is to pick something just because you think that that's the kind of research you're supposed to be doing in residency. Basically, what it comes down to is if you can think of a way to find an answer to a question that you have, or to make an improvement project for something that you really feel passionate about, either within the hospital or even out in our community, then we're going to be able to turn that into a scholarly project for you with almost no hesitation. As far as support, our residents have mentorship from their individual project mentors. We really work hard to help find a project mentor that is right for you and for your project, whether that's by finding you someone that's in the field that you're interested in or finding you someone that's really passionate about a similar project as you. It doesn't necessarily have to be that just if you know you're going into PICU that we find you a PICU doctor. It's more important to find you somebody that is going to provide a really good mentorship experience and shares your interests as far as the type of project that you're doing. One of the ways that we find people support in that way is through a series of presentations that we have instituted just this past year. Our interns give what we call an ROC, or Resident Research Oversight Committee, presentation, initially in the winter of their PGY1 year. So in January, February, typically, they'll present a very brief overview of their interests, if they have a project identified or not. Most don't at that point, and what they might be interested in pursuing. And we have a bunch of faculty who attend those. Basically, we try to create a lot of networking so that we can build upon their ideas and connect them with the right people. They then continue to have follow-up presentations twice in their second year, so once in like the summer, fall, and once in the spring, where we can follow up and make sure that they've gotten their project off on the right foot, they're moving forward, they're not running into major issues, and basically just to provide a little bit of follow-up accountability and to get to the point where residents aren't floundering on their own with something that's not working for too long before they reach out for help. So we try to give a lot of support in that way so that you don't have to stress out a ton about choosing a project. We're going to help you find one, and we're going to help make sure that it gets done and that you're not, at the end of third year freaking out because you haven't had anything. So we try to provide that support both directly from myself and from the Office of Medical Education staff, as well as from the mentors in the different divisions and their primary mentors for their projects.
Am I assigned a project and a mentor?
So the quick answer to this question is no, you're not necessarily assigned a project or a mentor. You are able to come up with really anything that's interesting to you. Some residents have a lot of ideas about exactly what they want to do. They have very clear projects that they come to us with, and that's great. But that's not necessarily true for everybody. Some folks come to us with just a vague, I'm interested in asthma, or I really want to do something in clinic and I'm interested in smoking education, or I'm interested in development, or, particular topic. And our role within the OME and scholarly activity is to take those basic ideas and connect you with someone who is either already working on that topic or someone who's interested in it and can help you to design a project together. Some residents join existing projects, whether that's something that an attending is already working on, or occasionally with really sort of bigger multi-stage projects, they'll join in with another resident or a fellow who's working on a project that has a component that a resident could work on independently. So you are not assigned a project or a mentor, but we work really hard to connect you with the right people so that you can find one that's going to work best for you.
I'm interested in fellowship, and I know that research is important for a strong application. What research opportunities are there in your program? And do residents present their research at conferences?
Great question. So a lot of our residents do come in knowing that they're interested in fellowship or develop that interest over the course of their training. About 50% of our residents end up pursuing fellowship from year to year. And it's definitely really important for us to develop the research aspect of that because that is something that they look for on fellowship applications. One of the really great opportunities that we've cultivated here at U of L and Norton Children's is the ability to delineate yourself into a track system. So for residents who are really interested in fellowship or academic medicine, we have a research track that's available. And basically what we try to do is create a more robust research experience for those residents. You apply to research track or to the other tracks in generally the late winter, early spring of your intern year. For research track residents, what this entails is basically trying to create an experience that's more like the research experience you'll have in fellowship. So for most fellowship programs, you have what's called a scholarship oversight committee or an SOC. And that basically follows you through your fellowship to help you design your project, follow up on your project, troubleshoot your project, and make sure that you get it done. And that's what we try to create for our research track residents. Basically from the get-go, as soon as they come onto the research track, we do just some group presentations of ideas where we have the new residents, our old team members, and a lot of research-minded faculty who come in and try to really build up those ideas that our residents have, get them connected with the right mentorship, and get their projects started. And then we do semi-annual check-ins and presentations, kind of similar to the ROCs that we talked about earlier, but a little bit more in depth, where there's a little bit more feedback and discussion of like the methods for your project and the design and how we can help with data analysis, get you with a statistician, things like that, to make sure that if you want to do something that's a little bit more robust or broad as a resident, that you have the ability to do so. We also have monthly meetings for our research track residents where we go into some a little bit more in-depth like scholarship and research topics. So things in the past have been advanced biostats, but also things like how do I actually write an IRB? How do I actually write a manuscript? How do I apply the things that I'm doing in my research to my daily life as a fellow or as an attending down the line? And so we have monthly seminars. Some of those are with other track residents like global health and advocacy, but some of them are just us. And the culminating factor is that they do a department-wide presentation in the spring of their PGY2 year where they present their research project. And as long as residents meet certain criteria for as far as attendance at the lectures and they complete their presentations as described already. And our goal is for all of them to submit, even if they aren't accepted, submit either for a poster or a presentation or a publication by the end of residency. If they complete all of those, they get a special certificate and we'll write them a small letter sort of detailing exactly what this has entailed so that your fellowship application and program directors know, this wasn't just a random activity. It was something really strong that you put yourself out there and really committed to. As far as research conferences, like I said, we really encourage our research track residents in particular to present to a conference, but any resident is welcome to apply to submit their project. There are multiple local and regional conferences that our residents very frequently attend, as well as, of course, national presentations at places like PAS and AAP. As a rule, we try to provide the financial support for residents whose projects are accepted for presentation at conferences. But as year to year, probably anywhere from 25 to 30% of our residents do present at conferences, and it's a really great opportunity.